We're off air. Okay, this is Dr. David Hall from Infinity Dental Web, and we have a Google Hangout here of some prominent cosmetic dentists from North America. We are discussing the new Uveneer product, which is a very interesting template for making composite veneers. We have here Dr. Elliot Mechanic, who's the aesthetic editor of Oral Health magazine in Canada. He lectures internationally on interdisciplinary dentistry and aesthetics, and he's the co-founder with Dr. George Freedman of the Canadian Academy for Aesthetic Dentistry. He practices in Montreal, Quebec. We have Dr. George Freedman, who is a founding member and a past president of the American Academy of Cosmetic Dentistry. He is the author of the textbook Contemporary Aesthetic Dentistry, a frequent international lecturer, and he practices in Toronto. And then we have Dr. Jack Ringer, who is the immediate past president of the American Academy of Cosmetic Dentistry. He also lectures internationally on contemporary aesthetic dentistry and practices in Anaheim Hills, California. So, and I'm Dr. David Hall, president of Infinity Dental Web. Anyway, let's start off by describing the new Uveneer product. Dr. Freedman, tell us what it is.
The Uveneer is a one-step plastic matrix, reusable matrix, that can be used by the dentist solo or with the help of an assistant to make a very aesthetic anterior facing for a tooth.
How have you used it?
I've used it for a number of procedures, most often when patients show up with broken anterior teeth, when I'm provisionalizing veneers for a week or two, and when I'm restoring the aesthetics for an anterior immediate load implant that requires a crown at the time of placement.
Okay, how about you, Dr. Ringer? How have you used this?
I've used it on a few times on an emergency basis when patients come in with broken incisal edges or significant diastemas, and so it's very quick and efficient. And I've also used it to help with designing aesthetic cases to create like a mock-up or a preview of what they can look like.
Okay. And Dr. Mechanic?
Where I've been finding this product very, very exciting is bonding for anterior teeth. Because this product, it gives me this form, it gives me the symmetry, and then all I have to do is I have to cut it back, customize it a bit, and off goes a happy patient. It looks great.
How long did it take you to do the 4 teeth?
With customization, roughly about 15 minutes a tooth. So I could do 4 teeth in about an hour.
That sounds great. How about you, Dr. Ringer? How long did it take you to do 1 tooth?
Well, it only takes really a couple of minutes after you do your minimal prep, etch, and bond, and just place the template on. You know, it's virtually done, and then you just have a little bit of finishing. So it's very efficient.
Okay. And Dr. Freedman?
I use the high viscosity composite, flowable composites, and with that, the entire procedure, beginning to end, including the polishing, finishing the margins, and creating a tremendous aesthetics, takes 5 to 10 minutes per tooth.
Very good. Okay, and Dr. Mechanic, now Coltine makes a product that it's different, but it has a similar goal, and that's the Componeers. And how did the Uveneers compare with the Componeers?
Well, the problem with the prefabricated veneers, which the Componeers are, is that you have to size them perfectly. And not all the Componeers fit the teeth well. And when you add to them, or when you modify them, you see the lines where you have to modify them. With the Uveneer, you could use any type of composite that you want. So there are no lines, and it's a seamless transition. It's a very easy product to use.
So is there any other product on the market that's a template like this Uveneer product?
No, there are no other templates. There's Componeers from Coltine, and there's Edelweiss from Ultradent, but both of those are pre-finished veneers, and they're far more costly and far more difficult to use.
Okay, Dr. Freedman, are the shapes varied enough?
Yes, the shapes fit into most patients' mouths. They're generic in the sense that they don't fit everybody exactly, but they don't have to because you use your underlying composite, flowable composite, to fill in the space between what exists and what you'd like it to be. The shapes are varied enough and the sizes are varied enough. I've never had a problem with the creation of the uh, aesthetics of any anterior tooth with the Uveneer system.
Okay. And Dr. Ringer, what do you feel are the benefits for the dentist and for the patients of this product?
Well, it's such a time-saving procedure that it's obviously beneficial to the dentist. Less chair time, less costs. Can pass the savings on to the patient. The patient is sitting in the chair less, so it's more comfortable for them, and it's very efficient.
Okay. And then let's address two different types of practices. Let's take a practice that, say, provides sophisticated aesthetic services. Do you feel like the Uveneer is appropriate for that type of a practice?
Yeah, it definitely has its place, particularly in helping to design the sophisticated case, creating like a template for the patient to get an idea before you move on to the more definitive ceramic work, for argument's sake. And even for those dentists who are doing sophisticated composite therapy on the patient, the Uveneer system can be a very good foundation, which can be cut back, layered in order to, and then to create the final optics, the sophisticated optics. So there's definitely a place in a high-end, if you want to call it, sophisticated practice.
Okay. And Dr. Mechanic, what about for a dentist who provides very basic aesthetic services?
I think it's the ideal thing for a general dentist just getting into aesthetics. A lot of them are afraid to do composite bonding. And the Uveneer system is like training wheels. It gives them the form, it gives them the shape of the tooth, and it's a great start for them to learn all about aesthetics and to give a patient, you know, a restoration that the patient's going to be happy with. And gradually they improve and improve and learn to customize, and they become master aesthetic dentists. It's a great thing.
Okay, so in summary, is this a product you recommend then, the Uveneer?
You can't lose with it. It's simple. It's simple. It's good at all ends.
Okay, what about you, Dr. Freedman? What would you say?
It makes the practice of anterior aesthetic dentistry easier, faster, and better. Yes, I recommend it.
Okay,
and Dr. Ringer?
Oh yeah, definitely. I mean, the cost of it is made up almost instantaneously just in the chair time and the satisfaction that you're going to be able to have from creating these works so efficiently. So I would definitely recommend it.
Very good. For those interested in more information, you can check out the Uveneer website, uveneer.com, where you can also purchase this product and learn more about it. And I thank you, each of the participants. Dr. Mechanic, thank you, Dr. Freedman, and Dr. Ringer. And this Google Hangout is brought to you by Infinity Dental Web from Mesa, Arizona. Thank you.
Thank you.